Hello everyone, welcome to my channel. My name is Tamara and here we talk all things social work. I wanted to come to you all and talk to you today in regards to what is very popular and one of the news that's like trending right now online in regards to the I'm gonna have to censor some words. I don't want my video to get flagged. The passing of the United Healthcare CEO and surrounding that. I have to kind of, y'all know what I mean. I kind of have to tiptoe around that. I don't want my video to get flags. The reason I'm bringing this to this channel, right? Because it's a social work channel. I'm a social worker, and just like in doing research and hearing about, a book called Delay, Deny, and Defend in regards to like the healthcare system and healthcare reform. I wanted to post to you all, my fellow social workers and those who are not social workers as well, but this is mainly, directed to my social workers or even my licensed professionals. But I'm a social worker, so that's within my scope of practice. What do you all think? Do you think that there is a need for healthcare reform? Do you think that there is a way that government can kind of regulate how healthcare claims are processed, denied? I know for certain insurance companies, there's a cap on how much they can charge for certain procedures. I was just listening to some articles and some news stories about, and reading comments about some people who are saying that they were told their anesthesia was going to be denied after a certain amount of time. They're not paying for anesthesia. Can you, I just can't imagine. I can imagine like, oh, we're only going to pay for 30 minutes worth of anesthesia. Like, why? Like, if the surgery is going to take an hour, right? And the doctors have an ethical responsibility as well, right? Hippocratic oath that they took to do no harm. So insurance is saying that we're not paying for it, we're not covering it, but the patient needs it. And then what happens? They're stuck with a bill, because that's up. If you look at your insurance and you look at how much stuff costs, I have done it before. After I had my son, I literally saw the charges of how much everything costs. It's very expensive. The average person cannot afford to pay for how much everything costs. And also in regards to even authorizations, I've actually had to do pre-authorizations. I've had to do it for patients. I've had to call and do pre-authorizations for myself when I had a surgery scheduled. And literally the day before, I was literally in the hospital checking in, getting my lab work, doing everything, and they told me like, oh, your insurance hasn't approved it yet. I'm like, what do you mean they haven't approved it? I was literally I had my arms taped up, was on the phone and walking in and out of getting my lab work done. I remember the nurse was so nice, and she was just telling me like if it didn't get approved by a certain time, I don't think they put me on the schedule yet, because everything wasn't approved. She was like, you can come back and everything. Thank the Lord, everything worked out, everything was approved. But I was really on the phone getting my labs like drawn in and out, because I was just like, I need this surgery. What do you mean the authorization hasn't went through, So just in regards to that, and other things which I'll talk about in another video, just advocating for yourself, right? As social workers, we have to advocate for ourselves, because we advocate for others. We also have to advocate for ourselves. But what about those who can't advocate for themselves, who don't know what to say, who just kind of just feel like they are at a loss of words, and they just feel so hopeless because of what's going on? You're already dealing with the medical condition, right? Physically, you're already dealing with stress emotionally, and then to hear that something may not be paid. So my main thoughts that I'm bringing to this channel and bringing to this video is, what do y'all think? For those who work in healthcare, I was a hospital social worker for many, many years. However, I will say I was inpatient, and I didn't have to deal with too many prior authorizations, a couple for medicines, but not really. I didn't have to deal with a lot. And usually, and if individuals didn't have insurance, then we would have an outside provider, outside vendor, see if they qualify for Medicaid. But in the hospital, if it's inpatient, they cannot deny you. It's against the law. They have to provide you with treatment and care. But could you only imagine too what that bill is? Because you will be billed. They can't deny you with care, but they will bill you. I've had to help patients apply for the application, and I cannot remember what it was called, but pretty much it's assistance to help pay for bills, pay for hospital bills, pay for hospital stays. But, reading, I was listening to certain stories, certain channels, certain things, and just hearing about certain stories about people not being able to afford medications, which I have seen that in the hospital. My department where I used to work for, we would either pay out of our department budget for those who couldn't afford medication, and there have been times where I literally paid, because let's say I got pushback about paying for someone's medication, and it was like $10 or whatever, how much it was. It wasn't ever, thank God, anything too high where I feel like I couldn't afford. I would have, sometimes I would pay out of pocket myself. I would tell them I got it, I'm gonna pay for it, I wouldn't pay to tell the patient that, because I wouldn't want them to feel, I would go to the pharmacy. They knew me. I would go to the pharmacy. I have my debit card, and they say how much it is, and they didn't care who paid for it, as long as they got paid for it. I would swipe my card and pay for it, And I just thank God that I was able to do that, and that I could do that, because I also firmly believe in treating people how you want to be treated, right? If I couldn't afford a medication, I would pray and thank God, for those someone who could come and pay for it for myself, and I knew that I could, afford to pay for their medication. But just things like that just makes me so sad. I've read and heard stories about individuals who, their children, they couldn't afford medication for their children. They've heard their children crying in pain because they couldn't afford certain medications. And that is just gut-wrenching to me, and just hearing with this happening, hearing so many stories about people who have been denied coverage, denied care, having to fight for, to get certain things paid for, I think is very, very sad. And that also leads me to my other question for the social workers out there. Like, what do you do? And I have my own answer, but I'm asking y'all. And I plan to do a live Q&A on this sometime soon. But I wanted to go ahead and put this out now so I can get y'all thinking, and we could have a Q&A about this. But what do you do when you work for an insurance company or you work for a for-profit, but you also have to do what's right for the patient? How do you do your job and advocate for the patient? Have you ever had to deal with that and have some ethical dilemmas and feel really bad about your job and feel really bad about what you do because you feel like it's not really looking out for the best interest of the patient? I feel like sometimes when we as social workers work for for-profits or we work for certain industries, we're kind of put in certain situations where we feel like we kind of have to choose. So sometimes that does happen. That's happened to me plenty of times. But I wanted to bring that to y'all. What do you all think? What do you think could happen, or needs to happen, or needs to implemented, so that patients and individuals who have certain medical conditions, their care isn't denied or postponed due to authorizations, due to a lack of payment, due to not being able to afford certain medications. And I was just thinking how I heard someone say that certain doctors, certain insurances, certain doctors and specialists will not take certain patients if they have certain insurance. And that is very true. I have seen that. I have witnessed that. I've been in the hospital before calling multiple specialists. I remember in particular there was a patient who he had, I think it was a type 1 or type 2, he was very young. He had to see an endocrinologist, I believe, a specialist, and like nobody would take his insurance. And I was calling around because of course, there are certain insurances that bill higher. The provider can get reimbursed at a higher rate than other insurances. And I was like, that's so sad. But on the flip side, I know some therapists, and I know some counselors, psychologists, some of the social workers who do not take certain insurances. I have definitely seen that. I have worked in private practice before where clinicians have said, I don't take Medicaid. I don't take this and that. You have to, or self-pay. I only do self-pay. So is it only harmful when medical providers who are treating medical, like physical conditions? What about us healthcare professionals who deal with individuals who have mental health diagnoses, who say, I'm not taking I don't take Medicaid, I'm sorry. Or you're gonna have to be self-pay because I literally have seen that. So, and I've heard individuals say, oh, I don't take Medicaid. I don't take Medicaid patients. And I've heard directors say, this clinician is at their cap for Medicaid clients, so I have to give this person to someone else. And in my mind, I'm thinking to myself, for me as an individual, when I did therapy, Sometimes clients couldn't afford copays. It's fine. It's okay. You can't afford your copay. They would ask me, like, is it okay? And I'm like, yeah, it's perfectly fine. Because, and praise God, like, I'm not worried about that. You know, like $25 is not going to break me or harm me. I'm more worried about your mental health and your well-being and not a copay. So what do y'all think? I just wanted to ask y'all. It's just so much to think about, and I just love having, like, bringing this to y'all to just see what do y'all think. Am I the only social worker who thinks this? And what are your suggestions? What do you think? What do you feel? Anything, please leave your questions, comment down below. I plan to schedule a Q&A very soon, so y'all look out for that, because I want y'all to come to the live. I want it to be interactive. I want to hear your comments, your questions, your concerns, everything. So anyway, thank you so much for watching. Please like, comment, subscribe, and I will see y'all later.